Okay, thank you for joining us today. The last few months, to say the least, have been challenging. We have all been impacted by COVID-19. We know that our gyms and fitness centers, along with many of our other businesses, have taken such a huge hit during this time, and our hearts truly go out to you. But for our gyms and our fitness centers and our clubs, this webinar is tailored just for you. To ensure the safety of our community and help you navigate this new normal, we have created a Smart Restart Davie County guide, which will be shown today that you should see on your screen right now. This comprehensive guidance includes many of the recommendations developed by the Davie County Health and Human Services, along with the guidelines from the CDC and other federal, state, and local agencies. This resource will act as a living document, which we will update as this fluid situation changes. The document can be found on the Chamber's website at daviechamber.com. Today's session will only be 30 minutes, and we will leave room for you to ask questions, and we encourage you to do so. Also, this webinar will be recorded and sent to you. I am thrilled to have with us here today the Director of Davie County Health and Human Services, Ms. Suzanne Wright, and Public Health Nurse and Communicable Disease for Davie County, Ms. Luann Angel. So now I'm going to go ahead and pass the torch to Ms. Luann to guide us through this.
Thank you, Caroline, and thank you for all of your work on the Smart Restart in Davie guidebook. It's to assist our businesses. It's a very valuable treasure. I want to say thank you to the callers today for your participation, and particularly for the sacrifices, which have been enormous, that you have had to make and have made in your business to protect others, your family, your employees, your clients, your customers, Davie residents. We appreciate your diligence and your cooperation with the executive order and the federal, state, and local guidance in this battle against COVID-19. We know that you're anxious to reopen, and we hope today's discussion will benefit you as you prepare to safely get back to business. I would like to refer you to the Smart Restart. Caroline has posted the beginning, I think it's page 37, and then the next section for today for exercise facilities goes on to 38. But earlier in the document, there's pages 4 through 13 that are guidance for all businesses, some good important safety recommendations, tips for communicating with your teams, preparing your space, cleaning, PPE, things that would apply to everyone. But our discussion today is talking about close contact services in the exercise facilities. Your work requires that you have limited customer interaction. And I know to get started back, your goal is to do this safely in order to protect your employees and your customers or your members. And we want you to think about how you've previously operated your business and routine safety measures that are implemented daily, such as your disinfecting and cleaning, sick employee policies, to name a few. We want you to think further regarding extra steps to take to protect employees and customers against COVID-19. If your business is in a building or facility that has been completely closed and sitting idle over this time, there's some things that you need to think about initially before you reopen. You need to ensure that your proper operation of your building systems, if your building has been closed, and by that I mean your water supply. A reduction in water use causes stagnant or standing water in the water system, and that can increase the risk for growth of Legionella or other waterborne pathogens. Also, taking steps to ensure that your air system is clean, replace HVAC filters, clean or disinfect existing filters, increase ventilation, open windows, or adjust air conditioning, and then a good deep cleaning or sanitizing your facility, your business, before you do open or bring all your employees and your customers back. The guidance in the I call it a playbook, but the guidance kind of starts with employee and customer protection. talks about employees and customers should be encouraged to wear PPE where applicable. And with that, primarily, we mean face mask or face coverings. Certainly, you wouldn't want to have someone use that when they were exercising if it would affect their breathing. But certainly, if you have a member working out and you have a trainer or a spotter guiding them, then it would be appropriate for that person to wear a mask. A mask protects others from the wearer's germs, basically. It doesn't really protect us from others, but it protects others from us. And this is probably something totally different from what your employees are accustomed to, particularly in the work setting. So it takes an adjustment. You need to think ahead about stocking those things, having those on hand for your employees, and then also for your members. You know, you can ask members to bring a mask to your gym or your fitness center, but some won't. So you need to have that available for them. The next thing is talking about sick policy. Employees who have a fever or otherwise exhibiting symptoms of COVID-19 should not be allowed to work. If they become sick while they're at work, they should be asked to leave work just to avoid exposing others. When we started working and following up on COVID-19, initial symptoms by CDC guidelines were fever, cough, shortness of breath, or respiratory distress. Symptoms have been broadened to include other things, particularly headache, sore throat, muscle aches and pains, myalgias, like if you have the flu. Some people have GI symptoms, nausea, vomiting, or diarrhea. And some people have reported a loss in their sense of taste or their sense of smell. That's been kind of one that's sort of, we hear that one often when we interview cases. A sign should be placed at the entrance that individuals who have a fever, cough, shortness of breath, or those other symptoms should not enter, meaning your members should be made aware that if they're sick, they should not come into your building. Practices in other places involve a symptom screening when your employees come in for their shift, having a temperature check. Those are things that would be beneficial to help make those determinations. If that employee is getting sick, then they shouldn't be there, possibly exposing others. And then encouraging your staff to report safety and health concerns to you. With the next section is, let me back up for the mask just a moment. Something to think about, masks should be disposed if they become wet or soiled. If you are using a client or a member or a staff member is using a cloth face covering, those can become wet or damp from our breathing. So, you know, thinking ahead, having enough on hand. If they're not soiled, they're not wet, then they could continue to wear that. There's a section in the booklet that talks about how to put on and how to take off PPE and how to appropriately use a mask to prevent further spread or exposing yourself. We can't stress how important social distancing is. Some locations may require barriers to be able to separate customers or employees. Thinking about the layout of your area, how your machines and things are placed, how close they are together, can they be separated? Or if they can't be separated, can you stagger the use of the equipment? Someone uses this piece of equipment, skip one, and someone's using the next piece of equipment. You want to stress and strive for a distance of 6 feet between machines. Group classes should be limited to no more than 10 people, and social distancing should be maintained. However, that information may change once these restrictions are lifted, current restrictions are lifted. There will be guidance, we expect, to say what your capacity and what you're allowed to have at one time in your facility. We know that this is a step-by-step process, and it's kind of like a soft reopening with hitting phase 2, and then further with phase 3. It's kind of like testing the waters. If you've reached your safe social distancing, then you wouldn't allow any more members or customers in. And then spacing them the recommended 6 feet apart if they're waiting outdoors. So marking off things, giving them a place to wait where they're not too close together. We can't say enough about disinfecting and cleaning. And I know with the type of equipment that you guys use, your staff is wiping down and working to clean that all along throughout the day. Providing additional hand sanitizing stations for your patrons or your employees. Employees should perform regular cleaning after every machine that's used, but encourage your members, your patrons, to assist with that. Provide them with cleaning things. And I know it takes extra staff to be more precise and diligent about that, but it'll be worth it in the long run. Bathrooms, water coolers should be sanitized after use, and other high traffic areas, thinking about doorknobs, counters, anything, if there's locker rooms or anything like that. And the equipment in itself, particularly free weights and other items that you use individually. No foods should be consumed on the premise by employees or customers. And if employees customers, employees should bring their own water and other drinks. If you have a water cooler, that's kind of a risk of spreading if everybody's handling that, unless it's managed properly and cleaned well. If you have a refrigerator with bottled water and those type of things, if you continue that, then make sure an employee is the one who accesses that gloved and hands it to the patron or your member like that. Contactless transactions. That's a new word in my vocabulary now, but we should limit cash handling and encourage our customers to use credit or debit cards, electronic payment forms, but also making sure that we sanitize that equipment, the payment terminals, the pin pads, the pins that they handle. One thing that I've seen done other places, retail places that have been open, is those type of things are slipped into a plastic sleeve so that you're not constantly putting a cleaning agent on that electronic equipment, but you're cleaning the plastic sleeve that's over the top of it. There are, as I said in the beginning of this document, some things about specific cleaning, things about surfaces, how to clean particular surfaces, how long the COVID virus lives on certain surfaces. It's really interesting to pay attention to that and think about even just in your own personal home, how that's affected. One other thing is shower facilities, cleaning between use. And showers create water vapors. Certainly COVID is an airborne illness, or it's by water droplet, by droplet precautions is what you follow. But thinking about things that aerosolize or steam in the air, if you have ill employees or if you have ill patrons, they're coughing or sneezing, then that virus could actually mix in that and expose other people. So it's important to screen for people who are ill to not come into the facility. Unfortunately, we have seen cases where people are testing positive, but they have absolutely no symptoms. And so those two people were tested, either they were a contact to a case or they had traveled. If someone, one question that you might want to add, and I've thought about this as we've been doing these talks throughout the day today, is when you screen, have they been in contact with a known positive case? Guidance for positive cases are, if a person has been determined to have COVID either by a test or suspected by symptoms and been advised that that's what they have by their doctor, they should isolate themselves home for 10 days from when their symptoms started, plus 3 days after they're fever-free with no fever medicines. On the other hand, their household contacts, people who have been exposed to a known case, are recommended that they quarantine themselves. They're not sick, so they just quarantine themselves to home for 14 days. That's the incubation period. So thinking about if somebody has had a known exposure, that may be a question that you would add to your symptom screening checklist. Ms. Wright's in the room. I'm just going to ask if she has anything else to add.
I think you covered it pretty well.
Okay. And we would open it up for questions now, or any thoughts or comments about how you plan or anticipate opening your business back up.
Hey, Claude, I'm going to totally pick on you. What are some of the things, I know y'all, deal with a lot of different avenues within the club. Are there any questions that you have for her? I know we're totally focused on gyms and fitness centers and stuff, but are there any questions that you have in regards to maybe the golf course or anything like that?
No, honestly, the reason I wanted to listen today was to see if anything would come up about do we have any ideas what's going to happen with pools?
Great question.
At this point, we do not. That's one of the things in the guidance that's sort of been on hold. We hopefully, in looking at the fact that we're reaching the summer season, hopefully some guidance will come out about that, but I really don't expect anything until we get into phase 2, at least. Okay. I'm sorry that I can't give you anything better than that.
No, that's our expectation too. We just don't know what phase. We assume that phase 2 pools, they fall under entertainment venues, but they're outside. So we assume the number of people that can be at one would be governed by the overarching, right now 10 people can gather together. It would obviously increase some. Do we have any idea what that increase might go to?
I do not. It's kind of varied for different businesses. We've talked with people this morning about restaurants and their capacity, and it has to do a lot with the spacing of things. Open air to an outdoor pool, it makes sense that it would maybe operate with more people, but I honestly cannot speculate on that because I'm sure I would be surprised by what the governor tells us.
Yeah.
One of the questions from one of our members that came in, Luann, who was not able to get on the call this afternoon, is the question about temperature checks. Is that something that they have to do? And if so, what's the best way to go about doing that? Temperature checks for their employees and temperature checks for their membership.
It's not a requirement, but in just looking at, from a healthcare standpoint, and that's my background, but then also businesses that have continued to be open, various types, have done that for employees, making sure that their staff is healthy, that their staff doesn't expose someone. As far as requiring that the members or patrons do, it would be up to each facility, their decision. They're privately owned businesses, so they can make that rule. Just making patrons aware that this is part of their attempts to keep everybody safe, that it's for just as much, for the members' benefit as it is for the employee and the business owner's benefit.
Got it. Thank you. All right. If we don't have any other questions, we'll go ahead and finish it up. So thank you so much again, Luann and Suzanne for joining in on this conversation. As things again change, we will be updating this document. And I hope that this webinar has been beneficial to you. So again, you can find this document at daviechamber.com. And remember, if you have additional questions, please reach out to Davie County Health and Human Services or the Chamber. And then also, Luann, you guys would be more than willing and able to do a Zoom call with a said business in our county to make sure that they're safe and do basically a walkthrough with them if they do reach out. Is that correct?
Certainly, certainly. And they can reach us through our COVID call center. That number is 336-753-6550. That call center is manned 8:30 to 5 days a week. However, if you call after hours or on the weekend, it rolls over to the nurse on call. So you would be contacted back by one of our staff members.
Okay, great. Well, this webinar is finished if we don't have any more questions. And thank you guys so much and hope you have a wonderful weekend.
Thank you.
Thank you.